Here's something that happened constantly when I was teaching anatomy and physiology at the graduate level. A student would come in having memorized everything, genuinely, they could recite pathways, name structures, define processes. And then you'd put a real case in front of them, something slightly off the standard presentation, and they'd freeze. Not because they didn't know the material. Because they'd learned the material and not learned how to use the material. And I want to be honest, that gap is partly on how we teach. I was teaching while I was also seeing patients in my chiropractic practice. Sports injuries, rehabilitation, chronic pain work. And what happened is, I'd be in the clinic with a patient and think. I explained this exact mechanism yesterday in class. But the way I explained it in the classroom doesn't quite match what I'm looking at right now. That friction, between the textbook version and the clinical reality, was the most useful thing I could bring back to the classroom. What case-based learning does, when it's done right, is create that friction on purpose. You put the student in a situation where they have to work through uncertainty, where the answer isn't labeled. Where they have to articulate their reasoning rather than recognize a pattern they memorized. And the discomfort of that, I mean students don't love it, is actually the learning. The question I asked students constantly was not, what's the answer, but, why do you think that? Because if they could explain the reasoning, the answer would follow. If they couldn't, the answer was just a guess that happened to be right this time. I think about this now in the context of clinical research. When I'm onboarding into a new therapeutic area, I don't try to absorb everything at once. I try to understand the framework. What is this disease? What is the trial trying to measure? Why are these endpoints the right ones? What does the patient population actually experience? The specifics follow from understanding the structure. Teaching taught me that. Understanding the why makes you adaptable. Memorizing the what makes you fragile.